Page 1. Sheffield Adult Social Care Volunteer Carer Training 2020. We are currently experiencing a large reduction in our workforce capacity as a result of the COVID-19 situation, and we are incredibly appreciative of the volunteering that is taking place. Page 2. This presentation has been put together specifically as a direct result of COVID-19 and is all about what we expect, the standards we work to within health and social care. Given that the data are still emerging, we are uncertain of the impact of an outbreak on our day-to-day business. In a stretching scenario, it's possible that up to 1/5 of our employees may be absent from work during peak weeks. We don't yet have entirely complete data on this disease, but as we learn more about the virus, its effects and its behaviours, for example, the timing and extent of the peak of an outbreak, its precise impact on individuals we are supporting cannot be estimated. We'll then review and, where necessary, adapt our plan accordingly. Everyone will face increased pressures at work, as well as potentially their own personal illness or caring responsibilities. Supporting staff welfare will be critical to supporting an extended response. The Council is in a high state of readiness to respond robustly to the coronavirus, which means that we can offer a high degree of assurance that we'll be able to maximise the effectiveness of our adult social care support and in doing so also respond effectively to the outbreak. Page 3. I'm now going to look at the values and standards that is expected of anyone who is working within health and social care. These are communication, dignity, equality and diversity, nutrition and hydration, person-centred care, fire safety, health and safety awareness, infection prevention and control, reporting and recording, safeguarding adults and children. Communication. We have to effectively communicate with everyone within the field of health and social care. We have to quickly establish a rapport with the people we are supporting and maintain and promote trust. Dignity. We have to ensure that a person's privacy and dignity is reinforced at all times, particularly when we are providing personal care. Equality and diversity. Everyone is different. We have to respect people's differences and respect everyone's individual values. Nutrition and hydration. This is a really key area when we are supporting older people. We have to ensure that their health and well-being is looked after, particularly with regard to food and drink. Person-centred care. Everything is done for the person. The person has to be involved in their care and support at all times and in all decision making. Fire safety. South Yorkshire Fire Brigade have a new initiative with regard to fire safety for people in their own homes. Some people we support may not be aware of the risks. If we see a risk, we have to put forward a health and safety fire alert. This initiative can involve the installation of new technology such as alarms, and these are automatically linked to the fire service to notify the fire brigade about any potential risks of fire. Health and safety. We'll look at health and safety in more detail within the next presentation, but just to say we have an absolute duty of care to keep everyone safe in line with the Health and Safety at Work Act. Page 4. Understanding your role. We're now going to look at some of the duties and tasks that you may become involved in as a volunteer. You may be involved in chatting to people and helping out at meal times, driving people to medical appointments or driving care workers around the city, shopping, collecting prescriptions and providing practical help around a person's home, assisting in care homes, making beds, setting tables and taking drinks trolleys around,
providing company and reassurance to people who live alone, helping unpaid carers have time to do the things they can't do whilst they are caring by providing a sitting service, and welfare calls, checking on food and drink, nutrition and sufficient stocks of essential medication. As a volunteer, you may be asked to support people either in their own home or in a residential care home setting. The agreed ways of working with each individual will be detailed in the individual's care plan. The safety and welfare of individuals is protected by ensuring that their care plan is followed and carried out in the agreed ways. This programme covers the type of care and support that we feel are appropriate for the role of volunteer and may include the following areas. It is essential that the promotion of dignity and respect throughout all practices is demonstrated. It is important that we use accessible means of communication with the individual to ensure that they understand fully what is being said and asked of them. We can promote dignity and respect by knocking on people's doors, waiting to be asked to enter, listening to people, spending the time finding out what is actually important to those individuals, providing privacy during personal care tasks, ensuring that in those situations where people may feel they're most vulnerable, they are supported. It is really important that when providing personal care, an individual's privacy is respected. We must ensure that during these personal tasks, we speak to people, we ask people, we cover people where there may be in vulnerable, exposed situations. We respect people's choices and encourage independence wherever possible. Sheffield City Council no longer have any older people's care homes. However, due to the current crisis, we may have to go into commissioned care homes to provide support. Page 5.
What you need to know. The kinds of tasks you may be required to complete are providing care and support. We have to work in a person-centred way. We have to communicate well with everyone. We have to build relationships, and we have to promote equality and diversity. We have to contribute to activities in a safe way, and we have to respect confidentiality. We are not allowed to discuss any personal information about individuals or staff with unauthorised people. We have to store records securely. You may be going into people's own homes. The people you support may share with you information about their lives, their families, their friends. You may see things that are considered to be private to how an individual lives their life. People you support will trust you. We have to respect the confidentiality of this personal information. And should you see something that alerts you or concerns you and you think someone is at risk of harm, you have to speak up.
Page 6. Promoting dignity. Whilst out there supporting as a volunteer, it is essential that we focus on the value of every individual, that their views are respected and their choices and decisions are promoted. We must not make assumptions about how they want to be treated. It is important that we support individuals with compassion and person-centred values, promoting their dignity. As a volunteer, you will have a duty of care to the people you support. It is really important that people are treated fairly and that their rights are upheld at all times. Page 7.
Health and social care values. There are 6 values that are recognised as applying to health and social care, and these are known as the 6 C's. Care, compassion, competence, communication, courage and commitment. Whether or not we are aware of it, we all live our everyday lives by a set of values that shape how we think and react. Values are beliefs and ideas about how people should behave which have been formed by our childhoods, our families, our backgrounds, our cultures, religions and relationships. Whilst we each have our own values, there are values which are important when volunteering in social care.
Page 8. Confidentiality. The basis of a good working relationship is trust. This is dependent on the individual being confident that personal information about them is treated confidentially. Information about someone must only be shared on a need-to-know basis. Any information should not usually be disclosed without the person's informed consent. The General Data Protection Regulations 2018 protects people's rights to confidentiality. It restricts how personal information can be used, stored and passed on. Personal details must not be passed on unless the person gives their permission to do so. These laws give you rights as a volunteer, but also require you treat individuals' information responsibly. People will often share very sensitive and personal detail. They will trust you. This must be respected. A lot of information and detail about an individual and their needs and support will be in the individual's care plan. They may not want everyone reading this. Remember, it is shared on a need-to-know basis. Page 9.
Consent to share information. Sometimes there are situations when confidentiality may have to be broken. In cases where a person is likely to harm themselves, a person has been or is likely to be involved in a serious crime, a person is likely to harm others, your safety is placed at risk, a child or vulnerable adult has suffered or is at risk of suffering significant harm. If you are unsure about confidentiality and you do not know what to do, it's important that you speak to a supervisor or a manager who will advise you on the agreed way of working. Whenever possible, individuals should provide their consent for the transfer of information. However, this may not always be possible, and there will be occasions when information normally considered confidential needs to be shared.
Page 10. Making choices. Individuals should be fully involved in any decisions that affect their care. Choices can only be made if people have information. Mental capacity. This is an important piece of legislation which supports choice and decision making. To promote the dignity of all individuals, they should be fully involved in all decisions that affect their care, including personal decisions such as what to eat, what to wear and what time to go to bed, and wider decisions about their care and support. Choices can only be made if people have information, if they know the options, the risks and possible implications. They can make the choice that is right for them. There are a number of ways that you could help the individual to make an informed choice. You can explain information, find people who can share their experiences, or ask for the help of more experienced workers. Sometimes an individual may not be able to understand and retain the information that they need to make a decision or communicate their choice. If this is the case, they may lack the mental capacity to make a decision. The individual may be able to make day-to-day decisions, for example, what to wear and what they want to eat, but not be able to make complex decisions, for example, things about money or medical issues. In situations where you are not entirely sure about the individual's capacity, please seek advice or guidance from your supervisor. Page 11.
Fluid and nutrition. Providing nutrition and hydration must be carried out in a person-centred way. Individuals should have access to fluid at all times unless it is restricted for medical reasons. Food should be provided in accordance with an individual's care plan and ensuring that their cultural preferences, health conditions and any allergies they may have are followed. If you are concerned about an individual's fluid or food intake, make sure you report these concerns to either your supervisor or manager or the individual's family. It's very important to work in person-centred ways and to provide food which is suitable and that meets individuals' needs. If a person has arthritis in their hands, they may need help with cutting up food or opening packs like yogurts. Does a person have any beliefs or preferences that affect the foods that they want to eat? Are there any foods they should not have because of medication? For example, some people on certain medications for depression should not have cheese. Some individuals choose not to eat certain foods, for example if they are vegetarians or vegans, so it is important that you know what this all means. Some individuals might experience difficulties in eating or drinking without help. This may be due to forgetting to eat if a person has dementia, side effects of medication which may affect appetite or cause sickness, poorly fitting false teeth, physical illnesses such as a person's had a stroke and this has affected the muscles around their mouth for chewing or hand for lifting, depression which may cause poor appetite, a visual impairment which may affect the way a person sees their food to eat. Providing for nutrition and hydration must be carried out in a person-centred way. Efforts must be made to meet each individual's needs and choices. Their care and support plan is an essential tool here because everything should be recorded when we are delivering this support. People should be encouraged to drink throughout the day and not wait until they feel thirsty, as feelings of thirst are an early sign of dehydration. Often, people avoid drinking for fear of having to use the toilet more frequently. But we need to keep moving too, because this is all part of health and well-being. If the care plan states that encouragement or help and support with eating needs to be addressed, this needs to be provided. Food needs to be served at the right temperature and within easy reach. If an individual needs specific utensils to eat independently, these need to be available too. And the care plan should identify all of these needs.
Page 12. Safeguarding adults. Adult safeguarding is the way of working and thinking that protects adults with care and support needs from abuse, harm or neglect. Safeguarding balances the right to be safe with the right to make informed choices. Harm can include ill treatment. This includes sexual abuse, exploitation and forms of ill treatment which are not physical. The impairment of health, physical or mental, or development, physical, intellectual, emotional, social or behavioural. Self-harm and neglect, unlawful conduct, anything which adversely affects a person's property, rights or interest, for example financial abuse. Safeguarding is everyone's business. Safeguarding includes supporting well-being, making sure that basic needs such as security, nutrition and hydration are all met. Safeguarding promotes independence. As an adult social care service, we are responsible for making sure care and support are delivered in ways that are safe. Every worker and volunteer has a part to play in this. Sheffield has its own policy in relation to safeguarding adults and regards safeguarding as everyone's business. Should you see or suspect that anyone is at risk of harm or abuse, it is important that you report and record any concerns immediately. Page 13.
Raising concerns. If an individual tells you that they have been or are being abused, you must reassure them that you will take what they are saying seriously, support them to communicate in the best way for them, tell them that you cannot keep what they are telling you a secret as you have a duty to protect them from harm, listen carefully to what they are telling you, reassure them that they will be involved in decisions about what will happen, and do not be judgmental or jump to conclusions. As a volunteer, it is your responsibility to respond to allegations of abuse or suspicions, and you must speak to a supervisor or manager straight away if you suspect abuse is taking place.
Page 14. Safeguarding is preventative and involves promoting the welfare of children by protecting them from harm and recognising the risks to their safety and security. If you are worried at all about a child, it is important that you report your concerns to your supervisor immediately, that you make a record of your concerns that is factual and sign and date it. If you feel that this process is taking too long, dial 999 and call the police. They can quickly remove a child to somewhere safe. Remember, safeguarding is everyone's business. As a volunteer, if you come into contact with children in any way, you must ensure that their well-being is safeguarded. For the purpose of this briefing, the term child or children includes any child or young person up to the age of 18. Page 15.
Health and safety comes first. As a volunteer, you have responsibilities to take reasonable care of yourself and others in the workplace. There are a number of activities that you must not carry out unless you have received special training. These activities could include the use of equipment such as hoists and lifts to move people and objects safely, medication. There is legislation and guidance that controls the administration, storage and disposal of medicines. Assisting and moving. It is essential that you know about safe moving and handling so you don't hurt yourself or the individual. First aid. If you have not been trained, you should get help from a qualified first aider or call an ambulance. You should not attempt first aid as you could make their condition or injury worse. Emergency procedures such as fire, explosion, flood, building damage, etc. As a volunteer, you have responsibilities to take reasonable care of yourself and others in the workplace. You may work with a number of individuals who all have different needs and who require different types of care and support. Any task you volunteer to undertake must not put them at risk or yourself at risk. An example of how you can take reasonable care of those within your workplace would be to report anything that could cause someone to trip or fall, like a frayed carpet or a wet floor.
Page 16. Risk assessments. Every individual should have a risk assessment as part of their care and support plan. This will have information on the person's daily care and support, for example personal hygiene or mobility, and how best to protect them and others from harm. A risk assessment contains information on possible hazards to do with the care and support provided and will also include any steps that need to be taken to control any risks. Risk assessments are a legal requirement and will give clear guidance on how to keep people safe and prevent danger, harm and accidents. For example, wearing personal protective equipment such as disposable gloves and aprons where necessary. A risk assessment is a clear set of instructions that you must read, understand and follow. If things change, you must report this to your manager or supervisor to ensure the risk assessment is up to date and current. Page 17.
Fire safety. Fires are a hazard in any workplace and can lead to injury or death. Basic fire prevention measures include: do not have fire doors propped open, as this will increase the speed at which a fire spreads in a building. No smoking or naked flames within the building. Do not allow waste to accumulate, which could provide fuel to a fire. Check escape routes are not blocked and keep them clear of furniture or boxes. Check that appliances and plugs are turned off to help prevent an electrical fire from starting. If you are supporting someone in their own home, these measures may not apply. You can support individuals to get advice to make their own home safer, but you must respect the choices that they make. For example, they may choose to smoke or may not have smoke alarms. A workplace will have their own specific procedures to be taken into account in the event of a fire, and you must make sure that you familiarise yourself with these procedures. If you work in someone's home, make sure you familiarise yourself with escape routes and agree with your supervisor or manager what would you do in the case of a fire. Sometimes there may be increased risks in an individual's homes that you need to be made aware of. For example, a person may choose to smoke.
Page 18. Infection prevention and control. It is really important that we do wash our hands with soap and water often and do this for at least 20 seconds. That we always wash our hands when we get home or into work. that we use hand sanitizer gel if soap and water are not available. Cover your mouth and nose with a tissue or your sleeve, not your hands, when you cough or sneeze. Put used tissues in the bin straight away and wash your hands afterwards. And try to avoid close contact with people who are unwell. We must not touch our eyes, our nose or our mouth if our hands are not clean. The symptoms of coronavirus are a cough, a high temperature and shortness of breath. But these symptoms do not necessarily mean that you have the illness. The symptoms are similar to other illnesses that are much more common, such as cold and flu. It is important that we follow the government's rules on personal protective equipment and social distancing. That involves the use of gloves, apron, masks and following the 2-metre rule where possible. When applying gloves, it is important that we wash our hands prior and afterwards. And it is essential that we do not blow into gloves to inflate them before using them. You are expected to use the equipment that is provided for you and ensure you have supplies at all times. Page 19.
Remember, at any time, if you are concerned about anything at all, please speak to your manager and seek advice and guidance. Thank you.